Assalamualaikum warahmatullahi wabarakatuh. Good morning. Peace be upon you all. The Honorable our lecturer in English for Academic Purpose or EAP, Mr. Ahmad Fauzi Jamaluddin. We are from Group M of Faculty of Medicine, Muhammadiyah University of Surakarta. Will present the test of the meeting 11. The theme is Common Illness and Condition. And our group chose the 13 themes. There are diabetes. Before that, allow us to introduce ourselves first. I'm Aisyah Nabila with student ID number J5002100079, and also my friend.
Hello, my name is Muhammad Firasan Amsumi with student ID number C500Z21007.
Hello, my name is Yesanor Fatima, student ID number G500210082.
Well, my name is Alfa Fazafa Zanfarma, student ID number G500210083.
Hello, I am Anindya Aurora Apriliani, student ID number G5010084.
Hello, my name is Namira Aisha Devi, student ID number G500210085.
Well, now we're gonna start the presentation. Alpha, please share screen about our PowerPoint. Okay, thank you. Now our presentation will start from Firoz.
Okay, so in this slide, I will explain about definition of diabetes. So, disease in which the body's ability to produce or respond to the hormone insulin is impaired. Or resulting in abnormal metabolism of carbohydrates and elevated levels of glucose in the blood and urine. According from World Health Organization, diabetes is a chronic metabolic disease characterized by elevated levels of blood glucose or blood sugar, which leads over time to serious damage to the heart, blood vessels, eyes, kidneys, and nerves. The most common is type 2 diabetes, usually in adults, which occurs when the body becomes resistant to insulin or doesn't make enough insulin.
Okay, next. Well, after discussing about the definition of diabetes widely, this disease can cause complication of this condition continues to get worse. So it is important to get the right treatment immediately. Now I'm going to talk about kind of diabetes. There are generally four types of diabetes are common in Indonesia. There are several classifications of diabetes, among which you probably memorize the most type and one, the first and two, diabetes mellitus or DM. There is also the diabetes experienced during the pregnancy known as the gestational diabetes. And lastly, there is the diabetes insipidus. The first types of diabetes is chronic autoimmune disease that occur when the body is less or not completely unable to produce the hormone insulin. The first type of diabetes is mostly likely caused by the immune system that is supposed to fight the pathogens, even mistakenly that is attack the insulin producing cells in the pancreas. And generally, this type of diabetes is occur and found in the children and young adults. The second type of diabetes mellitus, or GM, is the quoting from the CDC website. There is estimate about 95% of case of diabetes are the second type of diabetes. In generally, this type of diabetes can affect anyone and any age. However, the second type of diabetes is usually more likely to occur in adults and the elderly due to unhealthy lifestyle factor such as lack of movement and being overweight. Uh, to overcome the symptom of the second type of diabetes, patient needs to have the healthier diabetic lifestyle, such as regulating diet and increasing physical activity. Third is um, the type of diabetes that occur in the pregnancy woman. This type of diabetes occur during the pregnancy and can affect the pregnant woman. Even though there do not have a history of diabetes, according to the American Pregnancy Association, this classification of diabetes is because the placenta of the pregnant woman will continue to produce the special hormone. Well, this hormone is what inhibits the insulin from working effectively. As a result, your blood sugar levels become unstable during the pregnancy. And the last one is the diabetes insipidus. Diabetes insipidus occur due to destruction of the hormone that help regulate the body Fluid level. This disorder causes excess urine production, so the sufferers become frequently urinate in the large number. Diabetes insipidus characterized by an excessive amount of urine. Generally, a person excretes 1 until 2 liters of urine or urinates 4 until 7 times a day. But the people with diabetes insipidus, the amount of urine that comes out every day can reach 3 until 11 liters, and urination can occur every 15 until 20 minutes. The diabetes insipidus treatment as recommended by the doctor is to increase the fluid consumption or drinks a lot to avoid the dehydration and consuming the drugs to reduce the urine production. I think that's all from me. Next page.
Well, I want to explaining about causes of diabetes. In one is genetic factor. One of the avoidable causes of diabetes mellitus is genetic factor. That's why diabetes is often called a hereditary disease. According to the American Diabetes Association, type 2 diabetes mellitus has a very strong relationship with family history. Patients with type 1 diabetes also have a similar risk but tend to be smaller. And then number 2 is dietary habits. Unhealthy food such as eating junk food and fast food. And number 3 is stress. One of reason why stress can trigger a person to develop diabetes is due to an increase in blood sugar levels. When stress occurs, the body will try to release the hormone cortisol. This can increase heart rate and breathing. simultaneously stored glucose and protein from the liver will go to the bloodstream to be processed into energy. Eventually, the level of sugar in the blood will increase. And then number 4 is obesity. Obesity can trigger change in the body's metabolism. This change cause adipose tissue to release fat molecules into the blood, which will affect the cell's response to insulin. And then number 5 is unhealthy lifestyle. Unhealthy lifestyle, such as regularly doing physical activity or sport, this can increase the risk of diabetes because it will make your blood sugar levels always high. Thank you.
Well, next, the symptoms of diabetes. The general symptoms of diabetes include the first, increased hunger. Second, increased thirst. Third, weight loss. Fourth, frequent urination. Fifth, blurry vision. Sixth, extreme fatigue. And the last source that downhill. Type 1 of diabetes. Symptoms of type 1 diabetes can include extreme hunger, increased thirst, unintentional weight loss, frequent urination, blurry vision, and tiredness. It may also result in mood changes. Type 2 of diabetes. Symptoms of type 2 diabetes can include the first, increased hunger. Second, increased thirst. Third, increased urination. Fourth, blurry vision. Fifth, tiredness. And the last, sores that are slow to heal. It may also cause recurring infections. This is because elevated glucose levels make it harder for the body to heal. And then symptoms in men, in addition to the general symptoms of diabetes. Men with diabetes may have a decreased sex drive, erectile dysfunction, and muscle strength. And symptoms in women. Women with diabetes can also have symptoms such as urinary tract infections, yeast infections, and dry, itchy skin. Okay, that's all for me.
Okay, the next in here, I wanted to explain about the treatment of diabetes. Next. Okay, let's talk about the diabetes. Diabetes is a chronic disease that occurs either when the pancreas doesn't produce enough insulin or when the body cannot effectively use the insulin it produces. Insulin is a hormone that regulates blood sugar. So some in the person who have diabetes appears in their body have infection like pictures, and then to can measure how and blood sugar in our body, we can to use this machine. Everyone call this glucometer. Next. Okay, for your information, this is fact of diabetes. Source from WHO in 2014, 8% of adults aged 18 years and older had diabetes. In 2019, diabetes was the direct cause of 1 million deaths and 48% of all deaths due to diabetes occur before the age of 70 years. And in this picture from the Diabetes Federation, China is the country who have highest diabetes cases. Next. Next. So at the point, treatment for all types of diabetes, the first healthy eating. You can to avoid the junk food, and then you can to eat the healthy like this vegetable, and you can drink milk and eat other healthy food. And then you can do physical activity like this, you cycling, jogging, meditations, and then you can skipping on the others of the kind of exercise. Next. So at the point is the treatment for type 1 and type 2 diabetes. This is the kind of diabetes. So we can do comparison of the healthy person and then type 1 diabetes and the type 2 diabetes. The healthy person who after she eat, the stomach will produce about the glucose and the pancreas will produce the insulin. So the muscle can to work effectively. We can to compare if the type 1 diabetes who pancreas cannot to produce insulin, so the muscle cannot to work actively. Type 2 diabetes produces pancreas can produce the insulin, but insulin is resistance. The meaning if the pancreas can produce insulin, but this insulin cannot to work effectively, so the muscle is cannot to work effectively too. Next. So how we can do treatment for type 1 and type 2 diabetes? The first, monitoring your blood sugar. The meaning is, depending on your treatment plan, you may check and record your blood sugar as many as 4 times a day, or more often if you are taking insulin. And then the second is insulin. People with type 1 diabetes need insulin therapy to survive. Many people with type 2 diabetes or gestational diabetes also need insulin therapy. And then the third is oral or other medication. Sometimes other oral or injected medication are prescribed as well. Some diabetes medications stimulate your pancreas to produce and release more insulin. And then fourth is transplantation. And some people who have a type of first diabetes or 1 diabetes, a pancreas transplant may be option. Islet transplants as being studied as well. With a successful pancreas transplant, you would no longer need insulin therapy. And then the last is bariatric surgery. Although it's not specifically considered a treatment for type 2 diabetes, people with type 2 diabetes who are obese and have a body mass index higher than 35 may benefit from this type of surgery, bariatric. So that's me. Thank you.
Okay. This slide discusses about diabetes prevention. Next. In Indonesia, diabetes is the third deadly disease with a percentage of 6.7% according to the Ministry of Health obtained from the sample registration survey 2014. Next. 90% type 2 diabetes generally occurs in adults, but in recent years it has been found in children and teenagers, so that prevention is needed regarding this disease. Next. Some way to prevent diabetes. 1. Maintain ideal body weight. Eat a healthy diet between 3 until 5 serving of fruit and vegetables a day, composed of complex carbohydrate, low in saturated fat, and high in soluble fiber. 2. Routine activity. 30 minutes of moderate intensity physical activity daily, like jogging, swimming, and aerobics. 3. Avoid tobacco use, like smoking and chewing tobacco. Also, avoid consuming alcohol, may exacerbate cardiovascular complication of glucose intolerance. Next. Fourth, managing stress. And the last one is blood glucose test. Test blood glucose and HbA1c levels regularly for patients with indicated diabetes with glucometer. However, for prevention, regular health checks can be carried out. Next. Okay, the conclusion is nothing looks as good as being healthy feels. Next. I think that's all from me. Thank you.
Okay, I think that's all from our group. And if there's any mistake or wrong from us, please forgive us. Thank you, and I hope our presentation will give some good information and will be useful to all from us. Thank you for your attention and wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Warahmatullahi wabarakatuh.